النهاردة معانا السلام عليكم ورحمة الله وبركاته. معانا محاضرة Designing of Public Health Programs under Supervision Professor Dr. Amel El-said prepared by إناس إبراهيم علي. outlines اللي عندي اللي هنتكلم عليها introduction. 1 introduction for public health programs. 2 definition of public health programs. 3 importance of public health programs. 4 strategies for designing public health programs. 5 models for planning public health programs. 6 steps for designing public health programs. Introduction. Public health programs aim to prevent or control disease, injury, disability, and death. Over time, as this task has become more complex, programs themselves have become more complex. Increasingly, public health programs address large problems, the solutions to which must engage large number of community members and organizations in a vast coalition. Moreover, we should design public health programs well to achieve intended outcomes. Definition of public health programs. It refers to all organized measures to prevent disease, promote health, and prolong life among the population as a whole. According to World Health Organization, is the activities to provide conditions in which people can be healthy and focus on entire population, not on individuals, patients, or diseases. Thus, public health programs are concerned with the total systems and not only the eradication of a particular disease. Importance of public health programs. It includes promoting health, preventing disease, and premature of population. For achieving these purposes, we should cover 3 key areas. Number 1, health protection. Protection against infection, disease, and environmental threats. 2, health improvement. Target individual behavior or promote health by education, legislation. 3, healthcare services. Provide, analyze, and improve optimized healthcare services. Strategies for designing public health programs. 5 strategies. Number 1, build health public policy. 2, create supportive environments. 3, strengthen community action. 4, develop personal skills. 5, reorient health services. Models for planning public health programs. Assessing needs, setting goals and objectives, developing an intervention, implementing the intervention, evaluating the results. Steps for designing public health programs. Step 1, manage the planning process. Purpose to develop a plan to manage stakeholder participation, timelines, resources, and determine methods for data gathering, interpretation, and decision making. Plan to engage stakeholders, including clients and staff, in a meaningful way. Establish a clear timeline for creating a work plan. Plan how you will allocate financial, material, and human resources. Consider the data required to make decisions at each step and include adequate time for data collection and interpretation. Establish a clear decision-making process. Step 2. Conduct a situational assessment. Purpose to learn more about the population of interest, trends, and issues that may affect implementation, including the wants, needs, and assists of the community. This step involves identifying what is the situation, what is making the situation better, and what is making it worse, and what possible actions you can take to address the situation. Use diverse types of data sources of data, pooling company, community, partner organization, researcher, governments, private sector, and data collection methods as stakeholder interview or focus groups, surveys, literature review of past evaluation finding, or stakeholder mandates policies. Step 3. Identify goals, populations of interest, outcomes, and outcome objectives. Purpose to use situational assessment results to determine goals, population of interest, outcomes, and outcome objectives. Ensure program goals, populations of interest, and outcome objectives are aligned with strategic directions of your organization or group. Goal, a broad statement providing overall direction for a program over a long period of time. Population of interest, group or groups that require special attention to achieve your goal. Outcome objective, brief statement specifying the desired change caused by the program. Step 4. Identify strategies, activities, outputs, process, objectives, and resources. Purpose to use the results of the situational assessment to select strategies and activities feasible with available resources that will contribute to your goals and outcome objectives. Brainstorm strategies for achieving objectives. Using one or more health promotion frameworks such as the Ottawa Curator for Health Promotion or the socio-ecological model. Prioritize idea by applying situational assessment results. Identify specific activities for each strategy, including which existing activities to start, stop, and continue. Select outputs and develop process objectives. Consider available financial, human, and in-kind resources. Step 5. Develop indicators. Purpose to develop a list of variables that can be tracked to assess the extent to which outcome and process objectives have been met. For each outcome and process objective, consider the intended result and whether the intended result can be divided into separate components. The intended result can be measured. There is appropriate time for observing a result. Required data sources are accessible and the resources needed to assess the result are available. Define indicators to measure each outcome and process objective and perform a quality check on proposed indicator, ensuring they are valid, reliable, and accessible. Indicators are used to determine the extent to which outcomes and process objectives were met. Step 6. Review the program plan. Purpose: to clarify the contribution of each component of the plan to its objectives, identify gaps, ensure adequate resources, and ensure consistency with the situational assessment finding. A logic model is a graphic depiction of the relationship between all parts of a program, and is one way in which a program overview can be communicated. Review the plan to determine whether strategies effectively contribute to goals and objectives. Short-term objectives contribute to long-term objectives. The best activities were chosen to advance the strategy. Activities are appropriate to the audiences, and resources are adequate to implement the activities. We can apply these steps by using the DIME model. The DIME model is a process of program design, implementation, monitoring, and evaluation developed and used by the Applied Mental Health Research Group since 2000. The model is a series of activities that combine evidence-based programming with rigorous monitoring and impact evaluation. The purpose is to provide a rational basis and approach for local programming while also generating information and lessons learned that can inform future services. It has developed a manual of DIME which consists of 6 modules, each referring to a separate activity. The diagram below outlines the steps of the design, implementation, monitoring, and evaluation process. Qualitative data collection is the first step in the process, and the diagram indicates which of the subsequent steps are informed by qualitative data. A brief description of each step follows. Number 1, qualitative study. 2, identify nature of priority problems. 3, draft instrument. 4, translate instrument. 5, validate instrument. 6, study baseline. 7, program intervention. 8, program implementation and monitoring. 9, post qualitative and quantitative assessment. Qualitative assessment to identify and describe priority mental health and psychosocial problem. ده عبارة عن مديول 1. Variations in culture and environment affect how people understand mental health and psychosocial problems. By understand, we mean how these problems are described, how they are prioritized, their perceived causes, and how people currently deal with them. This information is vital in selecting problems that are important to local people for accurately communicating with them about these problems and for identifying interventions that are likely to be acceptable and feasible for local people and therefore effective and sustainable. Module 2, develop draft instruments to assess priority mental health and psychosocial problems. Having decided which problems the program will address, we then draft quantitative assessment instruments to address these problems. These instruments have various uses depending on the program: community or clinic-based survey, screening persons for inclusion in a specific intervention program, identifying those with severe problems who may need specialized services, including referral and monitoring, and evaluating the effectiveness of the services by tracking changes in severity and prevalence. The process of drafting appropriate instruments, including reviewing the published literature for measures that have already been developed for the selected problems, and comparing available measures with the qualitative data to select the measure that best match how local people describe the problem. These measures are then adapted to better fit local concepts. Drafting include translation. Terminology suggested by translator often differ from that used by local population, particularly by poor and uneducated people. Therefore, qualitative data is preferred as the best source for translating key concepts, employing the words and phrases that local people actually use will improve the understandability of instruments and therefore their acceptability and accuracy. The translators are instructed to utilize qualitative data to directly translate all signs, symptoms, problems, and topics in instruments that were mentioned by interview in the qualitative study using the same words found in the qualitative data. Only where concepts are not mentioned in the qualitative data do the translators themselves choose appropriate terms. Module 3 Study Baseline Prevalence Survey. Both baseline assessment and prevalence survey are based on the instruments developed in step 2 and 3. Baseline assessment refers to interview done using the instrument in order to establish the eligibility of individuals for participation in an intervention program. Prevalence survey performs the same function at the population level to measure the percentage and numbers of eligible persons in the population as well as giving some indication about the variation and severity of problems at the population level. Module 4 Overall Program Planning. This includes planning the program goals and objectives and the strategy and the type of interventions for achieving these. It also includes the development of process and impact indicators and the overall program work plan. Module 5 Develop interventions to address identified mental health and psychosocial problems. The quantitative data of on the perceived causes of the problems and what people do about them are critical to the intervention design. Interventions need to address the perceived causes of priority problems in order to make sense and therefore inspire both confidence and cooperation. The more closely interventions match the ways in which people currently think about and address the selected problems, the more likely the interventions are to be acceptable to them. Where there are differences, they need to be explained and agreed on by the local population. For example, using counseling to address a problem thought to be caused by poverty will take some explaining. Module بعد كده بنتكلم عن implementing and monitoring. This refers to implementing and monitoring of intervention and the overall program. It includes procedures for iterate changes in the planned activities as needed according to monitoring data. Module 6 Post-intervention assessment. Upon completion of the intervention, participants are interviewed using qualitative methods to identify potentially important unexpected impacts of the program. They are also re-interviewed using the baseline quantitative instrument to measure changes in the outcome indicators, such as problem severity and function where possible. The amount of change is compared with the amount of change experienced by a control group to determine the true program impact. وبكده تكون محاضرتنا انتهت.